Hi everyone, we're back with an amazing chat this week with Dr. Heidi McGrath, and this week we're covering everything related to the big C. The word no one wants to hear, your dog has cancer or might have cancer, but pretty much we're unpacking everything holistically, surgically, the rising rates, what you can do to keep your dog happy and healthy and hopefully let them live as long as possible. It doesn't always have to be doom and gloom, and we unpack that and talk about this with Dr. Heidi now. So I hope you enjoy this episode. So Heidi, you've said this crazy stat to me before, but I'll let you share, isn't there a crazy increase on how many dogs are now getting cancer, and why are we seeing dogs with this much cancer now?
Yeah, so the increase in cancer in dogs is the same as the worldwide increase in cancer in people being diagnosed with cancer. But for me as a holistic veterinarian, more than 50% of my canine patients currently are being diagnosed with cancer in their lifetime. So that's a serious statistic where 1 in 2 of your patients, you are having to help them fight cancer and help them on a cancer journey during their lifetime. So we didn't used to have that much cancer. There is far more cancer now than there was 40, 50 years ago in New Zealand, and dogs are not living as long as they used to live. So we are really short shanking them with their lifetimes because of cancer. Cancer is the number 1 cause of death at the moment in our pets.
That is just insane. A 50% increase. No, sorry, you're saying 50% of the dogs you see have got a form of cancer now. That's crazy. It just blows my mind because obviously I know if I put it back in my human perspective, we know what we need to do, or we can fuel our bodies with the right things. We'll try all of these precautionary steps for us, but dogs can't do that. It's only what we feed them. Or what we do to them, or how we extend their life for them. So it's so important as us as owners to make sure we're doing the right things.
So, for instance, in the 1970s, boxer dogs were living between 11 and 14 years. And cancer certainly existed, 40 and 50 years ago, but many vets would actually argue it was significantly less common than it is now. And boxers are a really striking example of a high cancer rate, as your family knows. So the average lifespan for boxers now is 8, 10, and cancer is the leading cause of death. Mast cell tumours are very, very common, and many breeders from 50 years ago would say that their dogs routinely reached into their teens, with some dogs reaching 16, 18. So that's a massive change in what we're doing. So yes, we've got better diagnostics. Yes, we do identify more cancers probably more quickly now. And certainly lots of veterinary oncologists agree that, there is a genuine increase in cancer incidence currently in New Zealand and around the world.
Touching on that mast cell tumour that you just talked about, so that's a nice lead into why Olive's Kitchen was started. And I know a lot of people know this, but a lot of people won't. We've got lots of new followers, and so Olive's Kitchen was born out of a real need because we've always been a boxer family, and we had a previous boxer pass away with cancer, which we did the pharmaceutical route. And then we got a new boxer, and within 3 years she had a mast cell tumour, and Mum really went down a rabbit hole of what are we doing and how do I fix this and how can I improve my dog's health, because I'm trying to do the best possible. And that's where we met Heidi and sort of worked out what could we do holistically to treat her, and obviously Doggy Daily was born out of an immunity boost to keep her happy and healthy during this time. And holistically we were able to extend Olive's life with a whole lot of things for another 7 years. So it's been
highly successful with a very, very aggressive mast cell tumour. They are particularly aggressive. So
so I guess
that holistic approach is very successful.
Yes, and there is ways to treat there's so many options. I guess there's so many different types of cancers, but with mast cell tumours, you don't always have to treat medically. And I guess it'd be awesome to talk through what are things that we can do as owners to eliminate not trying to not get the big C, or if we do have the C lingering in, what are things that we can be doing to stop it or keep them happy and healthy?
So cancer for me as a holistic veterinarian involves focusing on 4 main sections. So the first thing to understand is that the body is telling you that there's a lot of chronic inflammation. And normal inflammation is normal for healing, but where you've got chronic inflammation, it actually damages DNA on a cellular level, and that then encourages cancer or tumour development. So common causes are things like dogs having allergies increases your cancer risk, obesity increases the dog's cancer risk, having poor gut health, so a history of vomiting, upset tummy, diarrhea, being diagnosed with inflammatory bowel disease, those types of things, because that reflects that the microbiome is not happy. And 90% of the dog's immune system resides within the normal flora. The microbiome in the gut is what gives them their immunity. Chronic skin disease, so a lot of dogs that are itchy, scratchy, secondary yeast, secondary fungal, recurrent ear infections, recurrent skin staph dermatitis, those dogs are more likely to develop cancer because their immune system is not happy or it's annoyed. And then environmental toxins. We've talked before around the sprays, the poisons in the environment, the Roundup, the glyphosate, all of those chemical things create a load for the body, and those things are often stored in the liver, and then the body has a hard time detoxifying some of those things, heavy metals, and it's just a case of understanding that you're creating work for the body to do, and so the body's immune system's busy trying to do that instead of upregulating its cellular and humoral immunity to hunt out division that has gone wrong and remove that through apoptosis. Cancer is multifactorial, but certainly chronic inflammation is number one. The second thing we know that has really increased the incidence of cancer in pets is ultra-processed food. So many of the diets that we feed our pets today were simply not around 50 years ago, 100 years ago. We know about seed oils in human food. It's the same for dogs. We know about inflammatory, highly processed food. We know about artificial preservatives. We know about colouring and flavouring to make food that is not meat look red, with red 40, it's a known carcinogen. Those things are really unhelpful for a body. And the fact that those things are allowed in pet food is disappointing from a holistic health point of view. Many people don't understand that those artificial colours and flavours and preservatives, even natural flavour, is actually not natural. There's all sorts of weird gene chemistry going on to make ultra-processed food. And it creates a load for the body. Those oxidized fats are more difficult and create drivers of inflammation. Our environmental chemical exposure, likewise, the herbicides, the pesticides, the lawn chemicals. We're talking about wet grass being worse for their little feet, and then they lick their feet. The household cleaners and chemicals. Those things are toxic for dogs in many cases because they're walking on floors and licking their feet. Flame retardants that are often used in soft house furnishings can be quite toxic, and also a lot of plastics instead of natural, wood, wool, those types of natural things tend to be, less toxic for pets. But it's very, very difficult where you've got lots of compounds that can absorb through the dog's skin, through their paw pads, and through grooming behaviour. Those are the drivers of cancer currently. And then number 4 is that we have in New Zealand a genetic bottleneck. Because we're a small country, we have a small breeding pool of specific breeds like boxers. They were our family dogs as well. But there's not a lot of genetic diversity. And so what happens is where you have an increase of similar genes, then you can increase the incidence of cancer in those breeds. So that's where hybridization is helpful, because you have a genetic diversity which actually will boost the immune system and down-regulate the genes that are increased in cancer. So when you concentrate genes, you concentrate cancer susceptibility, particularly in breeds like the boxer, the golden retriever, and the Bernese mountain dogs are some of the dogs that we see overrepresented for tumours, including mast cell tumours.
Is mast cell tumour the most common dog cancer, or is there like other ones? Like, is there bone cancer? Like, is there?
It's one of the most common, and certainly it's the most common skin cancer that we see. We're often now diagnosing them weekly. I had one last week that I'm sending away, and for a little bit of nerdy science things. So there's histiocytomas that are called histiocytes, and then mast cell tumours, and they can look identical to the naked eye. Many mast cell tumours are very sneaky, and they can look like an insect bite originally. They can look like a squamous cell carcinoma on the nose or the ear. They can look like a wart, and someone will let those things rumble on for a while. They're really sneaky cancers. So, but we commonly are diagnosing them, certainly for us, monthly or weekly is not uncommon. So mast cell tumours are immune cells. That's where people don't understand. So they have a double whammy for the dog. They're not just a tumour, but they create a cytokine storm or a histamine storm that then the body floods with histamine. And we see these really nasty systemic effects on the dog, including redness, including itching, including flooding. There's changes in massive amounts of inflammation in the body. They dump histamine, they dump heparin, they dump cytokines. They're massive inflammatory mediators. So they behave like a tumour, but also an allergy attack at the same time. And that's why they're particularly difficult, because they change size. So they can look smaller one day and bigger the next, or bigger and then smaller, which can be quite confusing for people. They can become red, they can become itchy, they can shrink again or suddenly swell. And so the best thing to do is also always a biopsy or a wedge section. Send it away to the histopathologist and get a specialist opinion on, is this a normal lump, like a papilloma from the wart virus family, or is this a histiocytoma, which occurs commonly in young dogs, looks like a mast cell tumour, but it's not as much of a problem. Mast cell tumours are a really big problem for the body to deal with. And those breeds that are at much higher risk for those things. The staffies we see a lot more, the golden retrievers, the pugs, and of course our beloved Frenchies, which are often overrepresented for the same genetic reasons in our cancer stats.
So is there like regular checks that you suggest doing to your dog to like sort of be checking over and being like, hey, come and see us straight away, or send me a photo, what should I be doing to Jax tonight? Because now I'm freaking out, I haven't checked him properly, So an all over check. So I use my hands all over the dog, particularly in down and under their brisket or their chest, down the legs, checking on the tops of the toes and the paws, checking in often around the top of the tail and around their little backside of their legs, and just let your fingers do the walking. So these little tumours often will start, they are commonly round, raised, like a parapool. So I say to people, if they're red, itchy, round and raised like a parapool with straight edges, that's an immediate trip to the vet for a concern about a lump. Don't do the I'll see how it goes, because often with melanoma and mast cell tumours it doesn't go well. We need to get on to those things really, really quickly. But there's lots of things you can do in terms of a holistic approach for dealing with all cancers, but specifically mast cell tumours. Holistic approach to mast cell tumours
doesn't mean ignoring conventional medicine. So we are conventionally trained. Obviously, I'm a surgeon. Surgeons love to heal with steel. We love to take our scalpel blade and remove that tumour, give a nice wide resection, and then start to heal the body and change the environment that allowed the tumour to take hold and grow. And so that's where this wonderful holistic approach comes in terms of reducing histamine load. So that's things like a fresh diet, avoiding highly processed food, avoiding mouldy food. Now, you sometimes can't tell if food is mouldy, but there's a really good test. If you've got some processed food or some kibble, put a few biscuits in a little lid on the kitchen bench, cover it with a few millimetres of warm water, and leave it sitting on the bench for 2 days. And if it grows a grey fuzz mould, it means you have mould growth in your processed food. Now that can occur where biscuits aren't cooled properly. They're going into bags that are sealed, and the biscuits haven't got rid of that steam or extra water content, and it allows mould spoilage to happen. And this we saw a lot in food companies around COVID, because normal staff were sick or off. They had new staff come in, and sometimes people weren't following the correct training protocols around cooling food. And I personally dealt with quite a few dogs in particular that had massive mould toxicity that was found to be from bagged food. So that, that was scary. It can create sloughing, it can create vasculitis, but mould is toxic. So sealing the bag is really important. Small bags of food, not really, really large bags that you leave open. And just be aware of moist environments. So dry food will suck in moisture, and then you can have secondary mould contamination post opening the bag. But be aware there is also such a thing as mould contamination happening prior to you opening a bag of food. So being aware of those things as a parent is particularly helpful. All anti-inflammatory nutrition is well known to boost the dog's immune system. So that's the things that we always talk about. So the oily fish, the sardines, omega-3, omega-6, green lip mussels. Bone broth is really healing for an inflamed gut lining. Then you don't get leaky gut. Blueberries with quercetin. Of course, blueberries is in your senior Doggy Daily formula. That's why that's in there. Broccoli is my number one super antioxidant. Just grated broccoli for your dogs. Really helpful for cancer. And leafy greens. Good for the gut, good for the liver, increasing chlorophyll and lots of vitamins and minerals. So you're going to aim for high quality protein. You're going to aim for minimally processed ingredients. And you really want those omega-3 fatty acids to support the dog. And then that's where the holistic increasing the microbiome becomes helpful. So your probiotics are really helpful. Again, 90% of the immune system is within the gut. So we need to really get stuck in before our dogs are 8, before our dogs are 6, before our dogs are 3. Building an innate immune system happens when they're puppies. And this includes not allowing antibiotics in your dog before 1. This is a study that's been done both in dogs but also in neonatal children. It decimates their microbiome and it changes their biology for life. If you have to use antibiotics, please be really aware to use probiotics to rebuild that, and that can take 6 months. Again, be aware of the side effects of steroids and suppressing the immune system. The immune system has a job, and that's to hunt down cancer. If your dog's had antibiotics, if your dog has steroids, the side effect is that it will impact the immune system. So be aware when you make those choices. Other foods that you can increase and put in your dog's diet is things like our medicinal mushrooms. So reishi, shiitake, cordyceps, lion's mane, some of those mushrooms have got great veterinary studies in terms of their ability to be an ancillary or adjunct for treating tumours, particularly hemangiosarcoma of the spleen. There was an amazing veterinary study where they just used one of those medical mushrooms, and it was more effective than conventional chemo for dogs. I found that super exciting. Yes. That's where often Eastern medicine is slightly ahead of us, because of course they've been using a lot of those types of foods for a lot longer than we have. Nutraceutical support's really important from a holistic point of view for your dogs. So curcumin, I love green tea extract as an antioxidant, and then vitamin D. There's a beautiful study I read this week in terms of vitamin D deficiency and sunlight deficiency in people. The same goes for our dogs. They need to be outside. They need to be having normal, natural sunlight, and ensuring that the vitamins and minerals that they get from that normal sunlight is optimizing their immune system. I think a lot of our dogs are inside too much. I think potentially a lot of us spend too much time inside, and being outside for 15 minutes or 30 minutes, depending on the time of day, as a normal for your dog. A lot of dogs would be great if we could have them outside a lot more than that, but it's much better for their immune system to be outside. And then minimising environmental toxin exposure, because we're seeing a lot of dogs that have glyphosate that have been poisoned by, unfortunately, people putting phosphates in their garden and on their veggies. It's just it's very unhelpful for the dog to have those chemicals bombarding their body, because then we have to detox all of those things. So practical steps include filtered drinking water, trying to remove contaminants such as fluoride, chlorine is in a lot of council water supplies. So rainwater is particularly fantastic. Please don't use lawn chemicals. If you can avoid them, then please do. Use gentle cleaning products. I love the Eco range. I find them really helpful for our family home. Cigarette smoke is not helpful for dogs. I've had some patients where a little dachshund dog sat on the pet parent's knee while she smoked, and the dog, of course, inhaled that and got lung cancer. She was devastated. And then washing their little paws after chemical exposure. Cancer represents more than a lump. It actually tells us a lot more about what's going on in the body. And that's why this holistic approach has been so helpful in terms of boosting pets' immune systems, so they don't end up being a statistic of 50% of these dogs getting cancer.
Exactly.
We've got to do something, because unfortunately we are cutting these dogs' lives in half.
Exactly. You've got to start now and build, and just as you say, like the gut health, the immunity, the vitamin D, like the things you can do at home that are so simple, removing the toxins. Don't use stuff on your lawn. Like just the bigger picture. And I guess if you're making this change for your dog, do it for yourself too. Like it's
exactly.
We're doing it, you know, like we're trying to be better and healthy ourselves. It's like, like I don't want River to run around on lawn with chemicals on it, and then he's got on his hands as well.
No,
so it's like
no mum does, and no parent does either. So the goal when we're treating cancer is not just to remove the tumour. That is often something that makes us feel better, but you've then got to turn around and create the healthiest internal environment possible in that dog's body and immune system by lowering inflammation, up-regulating their immune system, optimising nutrition, support the microbiome, reduce the toxic burden, and then get the little obesity under control. So increase their fitness and optimise their weight. And when you combine that with surgery and appropriate veterinary treatments, the integrated approaches often provides the best opportunity for quality of life and longevity in pets. So that's my 2 cents with regards to cancer. Surgery is one part of the puzzle, but certainly if we don't change the environment that allowed that tumour to grow, we haven't done our best to help our pets. And it's honestly, it's one of the most important messages as a vet that I have to share, that many tumours look harmless, but they can be devastating for the pet. So early diagnosis and intervention is a really powerful thing. And then you can achieve, like with Olive, an excellent clinical outcome where the dog manages that disease but can live a normal life, which is what we all want. Health and longevity and wellness for our pets.
Absolutely. Oh, that was so good. Thank you. I feel like we really unpacked a lot in there, and it's also quite a serious one from us as well, like with all the facts. So lots to digest, and so many things that we can implement today, straight away, you know. So I think I'm excited to hear people's feedback on this one as well. I know that a lot of people will be listening in and really interested. Well, thank you so much.
My pleasure. I hope that that's helpful for people.
No worries. Okay.
There's always hope when we're treating our pets for cancer. It's scary, but so important.
There's integrated approaches here. It doesn't all have to be a one route situation, so it's awesome.